Sit down.
Oh, that's okay, Doctor.
Oh, grab it while you can. An empty chair's hard to find.
Thanks.
How you doing?
Okay. Things going okay.
I hear good things about you.
Thanks.
Yeah, Metzger says that without you, Kamehameha would be in big trouble.
I just do my job as good as I can.
It's about time for me to do the same. See you later.
Dr. Kalani, are you through your paper?
Yeah, sure.
Thanks. My newsstand was out. The day don't feel right without it.
And there I was, 26 years old, armed with my brand new MD for a lifelong battle against disease and death. But as I stood in the gathering darkness, in the Valley of the Kings, I shivered and wondered if that was all. Was I missing something? Was there more to being a healer? This man knew. Imhotep, patron saint of physicians, lived around 2600 BC. He was a doctor, architect, prime minister, and advisor to the king. He started out a mere mortal and ended up a deity. You know, it's often said that most doctors think that they're gods. Imhotep's the only one to actually make that transition.
It's terrific.
Isn't he? You want to have dinner tonight with him?
Yeah,
And he did it. Without MRIs, fiber optics, antibiotics, not even a stethoscope. But he did have an understanding. The paradox of ancient Egypt. Healing is much more than a postponement of the inevitable. Healing is a contribution to the art of life. And in the end, the art of life is preparation for the art of death. The technology, which has made our jobs easier, encourages us to focus so intently on the illness that we often neglect to look at the patient as a whole spiritual being. We mustn't let that most important part of being a healer fall into disuse. We must look to the past when those skills were almost all there was. We must remember the wisdom and artistry of Imhotep and let it guide us. Thank you.
I'm happy to say this isn't the last you'll be seeing of Dr. Culver. I'm proud to announce that Dr. Culver has accepted a position as head of our cardiology division.
Welcome. Congratulations. That's quite a coup, Maggie. How'd you pull it off?
For once in my life, begging worked.
Hey, this is cool, yeah? Got a war. George?
Yeah?
Cool, yeah?
Yeah, that's cool.
These are really nice. You carved them yourself. Where you learn to do that?
My grandfather, he taught me when I was a kid.
You really feel lousy, huh? Maybe if you do a little work on this guy, you get your mind off being so scared. You want to try? Huh?
Capilli, how you feeling?
Did you find out what's wrong, Doc?
Well, one thing is you're anemic, so we're going to order a unit of blood for you.
Once that's taken care of, you feel a lot less tired. I'd like to examine you. Let me help you sit up. Good. Okay. Okay. Good. Tony?
Yeah.
Okay, lie back down, please. No, this isn't a lot of fun. Deep breath. Questionable spleen tip. 4 finger breaths below the costal margin. Thank you, Mr. Capilli. Meet me in the viewing room. I'd like to review his x-rays. Sure.
Well, Henry, you can go ahead and take George down for the rest of his tests. George, you're going to have to wear a hospital gown now.
Henry said I could wear this.
Henry? No, hospital policy is you have to wear a gown.
Doctor, could I talk to you?
Sure. See you, George. Hey, I'm not big on rules either, Henry, but you can't just change them on your own.
I know, but he's scared, you know? See, some of us Hawaiians don't like to wear other people's clothes. Especially clothes someone might have died in.
Really?
Yeah. See, we believe that used clothes still contain the other people's vibe.
I didn't know that.
Yeah. Look, if it's a big deal, I'll tell him he got to change.
No. We'll let it ride for now.
I think it'll make him feel more comfortable.
You're good, Henry. See you.
You're late.
Sorry.
Take a look. Tell me what you see.
Mediastinal adenopathy.
Right.
Hodgkin's disease.
Very possibly. I think Mr. Capilli may be the exception to the 4th rule of medicine.
There are 4?
Oh, yes. 1, if it's working, keep doing it. 2, if it's not working, stop doing it. 3, if you don't know what to do, don't do anything. And 4, and most importantly, never call a surgeon. However, the patient's going to need an exploratory lab to determine the extent of lymph system involvement and confirm the diagnosis. So call oncology, show these x-rays to Dr. Overland, see when he can schedule a surgery.
All right.
And while you're at it, schedule a CAT scan.
Right.
Are you okay?
Just a little warm in here.
Oh, sorry, thank you.
Thank you.
Oh, this tie clasp is beautiful.
It's a scarab. I found it in a junk shop last time I was in Cairo. You know, scarabs like that were wrapped inside the bandages of mummies and placed over the heart as an amulet.
And what's the engraving on the back?
Oh, my heart, the most intimate part of my being, do not stand up as witness against me before the tribunal. Wasn't easy to get front row center in the afterlife. You had to pass the test.
Which was what?
Your heart was on one side of a scale of feathers, symbolizing purity on the other. They had to balance.
And what if they didn't?
You don't want to know.
Sorry I'm late. Jean, Maggie. I had a patient I had to schedule for surgery.
Would you like to hear a special?
I'd like another glass of water, please.
Just a gin and tonic for me now, thanks.
I thought you said you were starving.
Oh, the airline, you should excuse the expression. Cuisine didn't quite agree with me. Maggie, there's an inn on the edge of the Kilauea crater. Do you know its name?
Excuse me, Dr. Kalani, there's a coffee at the desk.
Excuse me.
Waiter, can I have an espresso? Make that a double espresso, and I did ask for a glass of water.
Thanks. Dr. Kulani. Is she stable? I'm leaving right away. No, don't bother, Doctor, on the Palau. Thanks, Caitlin. Thanks.
There. That's better. With all the time zones I've been through today, my thermostat's gone a bit haywire.
I've got to go. I have a patient in cardiac distress.
Oh, who's on call?
On a Palau, but he's jammed up. Gene, I could use a consult.
Of course, and I'll get the check. Waiter, check, please.
I asked you to dinner.
I insist. You get the card?
I'll meet you in the ER.
Okay.
Mrs. Andrews is a 40-year-old Hawaiian Chinese. She's overweight, she's hypertensive, and she's a diabetic in poor control. She came in with chest pain radiating to her left arm, and she's nauseated and diaphoretic.
Is she in here?
What's her pulse?
120 and Tourette. Her EKG shows acute changes.
And her blood work?
It's not back from the lab yet.
Looks like an acute anterior wall MI. What do you think?
Right, catheter to see if we need to do a balloon angioplasty. Excuse me.
Hello, Mrs. Anders.
Dr. Kalani, what's going on?
Don't worry, you're going to be fine. We may have to do a procedure to remove some blockage from your arteries, but it's routine. And you're in luck. Dr. Culver's here, and he's one of the best cardiologists in the country.
I can't run a line without a cardiac x-ray. Don't you have a cardiac catheter in this place?
Yes, we do,
Well,
Doctor.
can you get a prep stat, and could we clear the room a little bit, please? I can't breathe in here. Come on, ladies, please, let's go.
Dr. Kalani, I don't know about him.
Oh, don't worry, he's tops.
I could use a little quiet in here also. Now let's get this show on the road.
I'll double-check Mrs. Anders' history and be ready to
That
assist.
won't be necessary. I've done this procedure thousands of times. We're going to wheel this into the hall by ourselves. Now let's go.
Sir.
Let's go.
Gene, Mrs. Anders is my patient. I'd like to observe.
Where I come from, the referral makes her my patient, and I'd like to work alone.
Where I come from, it's common courtesy to admit the patient's regular physician during the procedure.
Do you want to do what's good for the patient or what's good for you? The bottom line is I work best alone. You choose.
My patient's care is what's important here, Doctor.
Well, then, good night, Dr. Kalani.